Good evening, everybody, and welcome to Faces of Cancer. Dr. Axelrod and myself are so happy to have you here, and particularly our speakers. It wasn't that long ago that cancer treatment meant just that, cancer treatment, and then you finished, and that was it, and you went along your own way, and whatever side effects occurred, and that was it. And so, starting somewhere in the 1980s, but actually after the 2000s, really became more aware of the long-term sequelae of cancer treatment and just having the diagnosis of cancer, and hence the field of survivorship came about. And the importance of survivorship is that it really acknowledges the effects of cancer apart from just the acute treatment, and really acknowledges the fact that anyone who's gone through cancer, including their loved ones, including other family members and friends, are all considered survivors. And the better we do with treatment, and we're doing really well with treatment, the more people that are surviving and living longer, and the more issues we have with long-term sequelae of cancer treatment. So today is a little bit of a celebration of our survivors. It's actually a big celebration of our survivors and a big celebration of the many people who have gone through treatment. And we have some of them here today, and they're going to tell their stories about their survivorship and their endeavors with cancer. Before we do that, it's my great pleasure to introduce Dr. Deborah Axelrod, who is a professor of surgery and the founder of the outreach program, as well as working very heavily with me in survivorship, as well as all aspects of breast cancer.
Okay. So welcome, everybody. I'm just going to reiterate what Dr. Myers said. It's a pleasure to have everybody here. We start back on our survivorship series in September, so hopefully you'll be joining for these other series that Dr. Myers runs. They're very informative, interactive, and good to have you there. So before we start to introduce everyone, and this is pretty much our 15th year of doing this. It varies every year. Sometimes we have a panel from the 20s to the 80s. And today I think we have a variety of ages that are represented in the stories that you'll hear. But before I do that, I'd like to just talk a little bit about something that is very dear to me when it has to do about cancer. So I could see a person who has a lot of degrees, who could be a CEO of a company, but yet they don't really understand what I'm talking about sometimes, and they can't make a decision based on the information that they are given. And what I'm really talking about is health literacy. So I wanted to just spend a minute or two talking about it and then giving you guys a test. Our audience response system is out, but I thought it'd be a little interactive and fun to do. I gave it to my girlfriend, who does actually run a company, a diamond company, and she failed miserably. But she's also dyslexic. And so these are some of the things that, we need to have whoever's caring for you be aware of things like that, because then we could make some concessions and work around some of those limitations. Okay. So this is our beautiful cancer center that many of you know. And here, you can have an early cancer. You can have a good prognosis, but you can have a poor outcome. And I think that some of the literature is very interesting. It's looking at health literacy and how low health literacy impacts on poor prognosis. And I think it's very important that we really haven't, up until just recently, fully comprehended why that's so important. So health literacy it's really the ability to obtain, comprehend, and understand the information that's given to you so that you can make a decision about your health. This was a study in 2006, which is pretty consistent recently too, that 12% of U.S. adults have proficient health literacy, which means that the rest really have low health literacy. And it's also interesting that the reports are of Medicare enrollees that 1 out of 3 have low health literacy. So you see how important it is. They gave a test to people at Kaiser in Colorado in the in the heart failure unit, and they gave them 3 questions. There were about 1,000 people. These were people who had severe congestive heart failure, and they were being cared for in their acute cardiac care unit. And the 3 questions were really very, very basic questions. One was who reads the health materials to you? And after they're read to you, do you feel comfortable and understand it? And then do you feel comfortable making a health decision? And if people answered that they didn't feel comfortable, they didn't understand it, they had a higher morbidity and mortality, so a higher complication and death rate from heart disease if they scored low on those questions, those 3 very, very basic questions. So I'm going to, just because I like this test, I think it really gives you some good insight. And Danielle forgot to put the answers down, so I have to remember the answers. But this is an ice cream label that many of you who are not diabetic would read from time to time because you eat ice cream. So this would be a Haagen-Dazs or a Ben & Jerry's or a Breyer's container. And this is just your understanding of reading and numeracy, which are 2 very basic and important pieces of information to be able to interpret your own health care. So if you eat the entire container, how many calories will you eat? Right. So it's 1,000 because there are 4 servings, and it's 250 calories. Okay. Well, this is smart crowd. If you are allowed to eat 60 grams of carbs as a snack, how much ice cream could you have? 60. 2 servings. Okay. But if we had the audience response, I know that there are some people who did not get that. I'm like, okay, 3. So your doctor advises you to reduce the amount of saturated fat in your diet. You usually have 42 grams of saturated fat each day, which includes 1 serving of ice cream. If you stop eating the ice cream, how many grams of saturated fat would you be consuming? 33. Okay. And if you usually eat, we're almost finished, 2,500 calories in a day, what percentage of your daily value of calories will you be eating if you eat 1 serving? Whoa, okay, maybe we need to make it harder. And pretend that you're allergic to the following substances: penicillin, peanuts, latex gloves, bee stings. Is it safe for you to eat this ice cream? Why not? Okay. Well, so you guys are really smart, but there are people who really don't do well on these tests, and we need to understand who they are, and we also need to provide maybe a learning platform that's different than the majority of other people that understand and know how to read an ice cream label. Okay, so moving on, and you can hold on a second. Okay. So moving on, you guys all know about the lost dog, right? Blind in 1 eye, missing right ear, broken tail, answers to the name of Lucky. So I think that you can find something good in every situation that you are confronted with. And we're going to hear 7 inspiring stories and experiences. So our first speaker is Neil Kirby. Neil is 65 years old. He is a passionate musician. Yes, this year. Percussionist, originally from New Jersey. Always attentive to others' needs, working as a doorman for a large cooperative, kept him busy attending to others' needs and carrying and lifting heavy packages. He has a brother in Arizona. Both his parents died recently, one at age 97 and the other at 92. Musician friends of his who are doctors and nurse practitioners at NYU Brooklyn campus referred him to Dr. Chichoa when he was diagnosed with lung cancer, and he's been on a clinical trial and played a character based on his experiences last year at the lung cancer awareness event at Tisch. as a member of a nouveau acting troupe, the Support Group Players. He has also hosted a healing drum workshop for cancer parents and families. Wow. So come and speak to us. I think better here.
Okay.
Yeah. Can you thank you.